know that you're glued to your TV set and your radio set today. Welcome to your favorite personality program, The Stewardship. This program is proudly organized by the Office of the Special Advisor on Civic Engagement, led by Honorable Olatunbosun Oyintiloye. My name is David Ojo, and I will assure you that you will enjoy this program with my guest today. You want to know my guest? I will show you my guest. My guest is the Commissioner for Health. He was once a special advisor on health. And today, we're going to be discussing about health matters, especially in the state of Osun. My guest today is Dr. Rafiu Olasunkanmi. You're welcome to Stewardship.
Thank you so much. It's a pleasure to be here.
All right, a pleasure to be here and a pleasure for me to be here as well, discussing health issues, especially in the state of Osun. Let's start with our conversation with this. How wealthy is our health in the state of Osun?
Thank you so much. I love that opening remark, how healthy or how worthy is our health in the state of Osun. At the risk of being immodest, I think we are doing perfectly okay. You know, we are wealthy health-wise. And of course, you know, wealth is not measured by the amount of money you have in your bank account. But, you know, whether you are healthy, you wake up hale and hearty, you know, you've got to be thankful to God Almighty. And I want to say that in the state of Osun, under the able leadership of our governor, Mr. Adegboyega Oyetola, we are not doing badly at all, you know, in the area of health. We are doing pretty much well, you know, stand to be challenged by anybody. You know, when you compare the health indices in our state to other states, you will see that health in the state of Osun is healthy.
Very, very healthy?
Absolutely it is.
All right, talking about the state of Osun. Osun has become one of the leading states when it comes to health revitalization. How did you get to this level?
Yeah, thank you so much. You know, when Mr. Governor came on board, that was in November 2018, you know, he set up a committee that should look holistically into our health in the state of Osun, out of which my humble self was a member of the committee, and a few of my colleagues in the former administration. Mr. Governor himself was the chairman of that committee. And basically the work of the function of the committee was to look at how we need to improve on our health in the state of Osun. You will agree with me that, you know, Mr. Governor himself, being a member of the previous administration, he knew the challenges we had in that area, and he wanted to get it right. So it was recommended for the state that we should concentrate on primary health care, and that was the main reason why we started revitalization and rejuvenation of our health centers. You know, we said we wanted to renovate one health center per one political ward. You know, we have 332 political wards in our state, and as we speak, over 320 or thereabout had been completed and have been put to use of those health centers. The remaining will soon be completed in the next 4 or 5 weeks. You know, we will have had 332 health centers being renovated in our state. And I want to be challenged. I do not think there's any state in Nigeria that has embarked upon that massive renovation of health centers, you know, in our country. Not only renovation, you know, we made sure that we sank motorized boreholes in each of those health centers. We made sure that there's provision of drugs in each of those focal, we call them focal health centers, and of course, basic equipment that, you know, our doctors and all other health workers will need to work, to discharge their duty, we are provided for them. So we have done well in that area. Now, we believe it is not only about renovation and all that. We need to make sure that it is the functionality of those health centers that really matters to us. And of course, we are challenged just like any other, state in the area of human resource for health. When the Basic Healthcare Provision Fund started, we are one of those 3 states that pioneered it: ourselves, Abia, and Niger. Even as at the time that we had not, there was no money for us to commence the Basic Healthcare Provision Fund. Our state made sure that we provided we wanted to start just to pioneer the basic healthcare provision. When it starts generally, how will it look like? So we made sure that in each federal constituency, we had 33 health centers. We had 9 federal constituencies. So, and of course we added 3 more in the state, making 30. That we pioneered the Basic Healthcare Provision Fund. So that was unprecedented. We made sure, Mr. Governor provided money for us to be able to do that, to kickstart the tenet of Basic Healthcare Provision Fund. So having done that, so now Mr. Governor now felt that our work shouldn't be only on primary care. We believe that that's the closest health center and closest health facility to our people. We have challenges in our secondary facilities and in the tertiary as well. So those our people in the state of Osun, we bear me witness that the state of things of our general hospital in Ejigbo and Ifetedo was nothing to write home about. You need to go to those 2 general hospitals now. What we've been able to do in them, completely different hospital as we speak. And there was a time Mr. Governor came when he visited our state specialist hospital, Asubiaro Osogbo. When he got there, he said, "Look, you call this place a specialist hospital. Maybe we should even remove the name specialist. That at best, this cannot be more than a health center." And of course, that's our best secondary facility in the state. So we presented the challenges we had in that place. So we renovated our emergency department in that place. It had been damaged by monkeys because of the proximity of that place to the Grove, Osun Grove. So quite a lot of renovation we did in that place. We've never been troubled by monkeys anymore. We renovated our blood bank in Asubiaro. We renovated the pediatric ward, the maternity ward, and those places. And of course, the previous administration built a theater, due to one reason or the other, there were challenges in that place. So we equally renovated that place. And benefit of hindsight, if that hadn't been done, when we now had challenge, I will come into that, when we had challenge of COVID, when the whole world, had that challenge.
Before we go to COVID.
No, I'm not going there yet. So those are things that we did in State Specialist Hospital Asubiaro. As we speak, 120 beds that we are constructing in Asubiaro is about 65-70% completed now. With quite a lot of private wards, semi-private wards. We have offices for our consultants. We have a lounge where relatives of patients. We do not want relative to be just loitering around. If you have relation in the hospital on admission, we should have permission for you. All that are embedded in the 120 beds that we are building in Asubiaro. We fully completed 30 units flat for our junior doctors, because we do not want a situation whereby you are on call as a junior doctor and the patient is brought to our emergency that they need to go to your house. Probably only God knows where such doctors will be living. So we want our doctors, junior doctors in particular, to be living inside the hospital, so that any point in time that we need to have doctors at our emergency department, readily they will be available. That has been completed. We equally, commissioned that. Same as Asubiaro, Mr. Governor provided for brand new ambulances for us, apart from the old ambulance, brand new ambulances for us for utility use of the hospital. We have that now.
Can you mention how many ambulances?
In Asubiaro?
Oh, yes.
Oh, we now have 4.
Oh, beautiful.
Previously we had 2, brand new one now, making them 4. So at any point in time, we have ambulances are standby. They are on standby in that place. And of course, that is equally linked to COVID. We are not talking about COVID yet. We now have an incinerator in Asubiaro. We have incinerator that is 75 kilograms per hour. That even if you want to incinerate a human being in 1 hour, it will turn into ashes. We have incinerator. So all the medical waste in that place, the way by which we dispose them are not in compliance with WHO standard. So with our incinerator there now,
makes it easier.
We do that. So those are the things in terms of infrastructure and all that. I've just mentioned the primary care center, secondary health centers, and of course, looking at our all other agencies, look at our health insurance.
Before we go to health insurance, I want to the primary health centers.
Yep.
Lots of people are clamoring for more. What is the state government? What's the governor doing to make sure that we have more primary health center in the state of Osun?
Well, we probably have the largest number of health centers in Nigeria. Not even Lagos State, with a population over 20 million. They do not have the number of health centers that we have. Functionally, we have 876 health centers that are functioning in our state, out of over 1,000 of them that we have. It is from out of these 876 that we now renovated 332. See, what we accept on exceptional cases, we do not want to embark on building more. We want to make sure that those that we have, they function really, really well. Like I said, except we have, to every rule, there must be an exception. Because I'm happy to announce here that, I visited a place, a rapidly developing area in Egbedo, we call it Onigweja area.
Okay.
They will have probably over 15,000 people living in that place.
Fantastic.
With no health facility at all, either private or public. So they invited me, I was there. I said, well, there's a need for us to have a health facility there. I presented at the ESCO, the Executive Council meeting, and it was graciously approved by Mr. Governor. So those are exceptional cases where government can build. Otherwise, we do not want to embark on building more. We want to make sure those that we have, they function really, really well.
This conversation is getting interesting with Dr. Rafiu Olasunkanmi on some of the achievements in the health sector, especially in the state of Osun. If you're just joining us, you've not missed much. Let's talk about COVID-19.
Yep. COVID.
Oh, yes.
COVID. SARS-CoV-2, severe acute respiratory virus, CoV-2.
How is Osun being able to manage COVID-19?
Well, first and foremost, we give thanks to God Almighty in whatever we do. We must always appreciate God. And especially, we have to appreciate the governor of the state of Osun, Mr. Adegboyega Itona, for his exemplary leadership. The way at which we managed and we still manage COVID-19 in our state. Even before we had our index case in Osun, myself and my colleague, special advisor to Mr. Governor of Public Health, we embarked upon reclassification of some certain areas in our state. We know there are some areas where we have a lot of foreigners, non-Nigerians that live, especially our mining sites. It took us about 2 weeks or thereabout for us to map out those areas in case, because we knew we had COVID-19 originated from Wuhan in China. And of course, those who are mining our gold, the overwhelming majority of them are Chinese. So we actually wanted to make sure that no new person recently came to our state then. So we did all that. We prepared to the best of our ability well before we even had the first case of COVID-19 in our state. And of course, when we did, the case was managed in Asubiaro. And, crucially, I want to bring it to our memory. You remember we had this challenge, people from Cote d'Ivoire that came to our state.
I wanted to ask that.
Yeah, many of them, we are not even from our state, from different states, different tribes. Many of them from Edo, Anambra, Imo, Rivers, Delta, people from the north as well. So, and the way by which we manage that, otherwise, it would have been extremely difficult for us as a country, because if those people were let loose back to their states, only God knows the number of people, they will have infected and all that. So we thank Mr. Governor for that. In our state, all the pillars that we have, we are well taken care of. We have a COVID-19 team headed by His Excellency, the Deputy Governor, Mr. Bennett Oluboyega-Alabi, of which myself and the SA, we are assisting him, and other members of the committee too. So we have our isolation center in Asubiaro. We have 20 beds, isolation beds. We have our intensive care units where we can manage those who have severe difficulty in breathing and those that cannot even breathe at all, secondly to COVID-19 infection. So we have our ICU. We have 8 beds, ventilators in ICU too. We have a theater, well-equipped theater, just in case somebody tested positive and needed surgery, where we can have surgery for that. We have that with state-of-the-art equipment and all that. Same as Subiaro. We have a isolation center in Mercyland that could take up to 300 patients if need be, if that's the case, with state-of-the-art equipment, facilities too. And of course, we were assisted for that on the COVID. Some private people who pulled their resources together to assist federal government. So they assisted us in that area. So that is that. We have a isolation center in Ejigbo. We have a isolation center in our general hospital Ejigbo. We have at Obafemi Awolowo Teaching Hospital Complex. They gave us an abandoned building that we renovated. We have an isolation center there. So reasonably, we did well. As a result of that, Mr. Governor had won awards, as a result of the way by which we managed COVID in Osun. Of course, Lagos is the cynosure of everything. Lagos was the epicenter of COVID in Nigeria and all that. But when you consider the amount of money available to Lagos State and the amount of money available to us in Osun, you will agree with me that we didn't do badly vis-a-vis management of COVID in the country. And of course, COVID hasn't gone. We still battle with COVID management. But reasonably, we have done well. When you look at the number of number of mortality that we have as a result of COVID-19 infection compared to other states, it's in the news what each and every state did. Where at the time we had our lockdown, when some of our neighboring states, didn't comply with that. That was in lockdown. The challenges we had in preventing people flossing to our state and all that. But to the glory of God, we reasonably managed COVID well in our state. And thanks to Mr. Governor for that.
All right. When our crew walked in, I saw you with nose masks. I saw you with hand sanitizer. What are you doing?
You're wondering?
Oh, yes. What are you doing to make sure that this kind of message is passed to every single individual in the state of Osun?
Thank you so much. In the management of COVID now, basically what we lay emphasis on now is our risk communication. We need to enlighten our people and re-emphasize the fact that even though people have had COVID vaccine, that does not mean that they should disregard basic COVID-19 protocols as laid down by NCDC. So we still want our people, even though you've had your vaccine, some people who have the privilege of getting booster. On top of that, you still need to wear your face mask. You need to maintain hand hygiene. Continue to wash your hands regularly, or alternatively, or you can use hand sanitizer, and try as much as possible to avoid large gathering. We cannot emphasize that enough, because that's the only thing we can do. We can only do more on prevention and all that. Granted, all of us, we now have what we call COVID fatigue, because it's been long that we've been living with this COVID. Leave us alone, Jare. How many people are even dying from COVID? Enough of all this, things like that. Very bad. People are dying from COVID. People are dying from COVID. I'm equally bereaved recently from COVID too. So our people should bear it in mind that It is not enough that we've had vaccine, that we should do what we like. We should not do what we like. We should continue to mask up, should continue to maintain hand hygiene, should continue to avoid large gathering. This is what we need to do, because until the last person with COVID is treated and got well, and of course we tell our people that people should not be selfish. Like if I say, okay, it's fine, I've had my 2 doses and I've had booster as well, okay, I'm okay. The truth of the matter is that somebody who hasn't had COVID, somebody can give me COVID, I can still have COVID infection, but it may not affect me that much. The likelihood that I will die from COVID will be nil. The likelihood that I will end up in ICU is nil. But if I have COVID, I can now give it to somebody who hasn't had vaccine. And what is the percentage of people who have had this vaccine? Low, even as a country. That's the more reason why we need to continue to maintain those protocols. You cannot say because you have had vaccine that you will not wear a face mask, you will not comply with those protocols laid by the CDC. I beg our people in the state of Osun, we should continue to do that, and we should make ourselves available to have this vaccine. And of course, this negative propaganda about vaccine is not true. It's not true. COVID vaccine, that if you have COVID vaccine, it will magnetizes your body, it does this, it does that. They are all fabrications. It is those who have one thing or the other against the vaccine that are spreading that unfounded rumor. It is not true. People should go and have this vaccine. And of course, people say the white people, they want to kill us. Why do they have to spend money that much on vaccine? Because they want to kill us. There are 1,001 ways that they can use to kill we black people, if that is what they desire. Nobody has any intention of killing anybody. We all want everybody to live a healthy life. We want the whole world to be free of COVID, because we know what it has done to our economy. We know what it has done, the amount of human loss. We have recorded globally. It's gargantuan. It's unprecedented.
Fantastic. All right, let's talk about your achievements in the Osun Health Insurance Scheme.
Thank you so much. Mr. Governor's achievement.
Oh, yeah. Your achievement, Governor's achievement.
Yeah. You see, Mr. Governor has really done well for us in our health insurance. When the social health insurance, we are one of those states that started late, but other states now come to us. They now come to us how we do our health insurance. It is to the glory of God. We have done reasonably well, and I can turn my chest that we have done well on health insurance. When you consider the number of enrollees we have had, both public and private, both formal and informal, it's encouraging. And of course, the so-called vulnerable people, Mr. Governor gave us 500 million naira for us to be able to register vulnerables so that they can have access to health insurance. That is unprecedented. We still continue to encourage our people to hook up to health insurance. You see, people who have this perception about insurance, anything insurance, that insurance is a scam and all that. You can't blame people, because maybe the insurance, the motor insurance, home insurance, or whichever insurance people have had in the past is what is giving them that belief. Our health insurance is real and it's working well in the state of Osun. So I enjoy our people, to hook up to it. And we advise, especially political office holders, all the cabinet members, local government chairmen, councillors, to equally try as much as possible to help our people in our respective constituency that will pay for premium for people, for vulnerable people that cannot afford to do that. By the time we do this, universal health coverage in our state will really be, a top notch.
All right, your final shot before we leave this program. What will be your legacy in the health sector, especially in the state of Osun?
Well,
just few words.
Yeah, when you introduced me, you said, yes, I've been a special advisor before. It's a privilege, to which I thank and appreciate those who appointed me. And now I'm a commissioner too. I believe within my ability, I've put in my best, and I believe other people can actually judge us. I believe our health now in the state of Osun It's better than what we had, 10 years ago. What we have at the moment is better than what we have 10 years ago. And we are not resting on our oars. We want to make sure that before we finish our first term in office, before Mr. Governor finishes his first term in office, we are going to improve tremendously. We are going to have electronic medical records in all our hospitals, especially those secondary health facilities and selected primary care centers in our state. We want a situation whereby you do not need to carry your cards again. When you have any problem, you go to your district, probably you can ask for your phone number or your date of birth or something, and they will be able to get all your records. We want our people to go to Ilara. When somebody lives in Oshobo here and he goes to Ora or Okela, you are sick, you go to our hospital there, Mama Kiloru Koyin, tell them your name, and they bring out all your records. That is what, and that will be accomplished before we finish our first time in office.
All right, that will be what will be accomplished when Dr. Rafiu Olasunkanmi finishes his office. You agree with me that it's been interesting having a chat with the Commissioner for Health today on our program, Stewardship. My name is David Dojo, but special thanks to the Special Advisor on Civic Engagement, Honorable Olatubosun Oyintiloye, for making this program a reality. My name is David Ojo once again. Goodbye and God bless.